Wash your hands thoroughly with soap and water. Check the tip of the dropper for any cracks. Shake well before use. Avoid touching your eye with the dropper tip. Tilt the head back and pull the lower eyelid of your eye with your index finger in such a way that a pocket is formed. Hold the dropper with the other hand with the tip down. While looking up, put just one drop from the dropper into the socket at the bottom of the eye. Close your eyes for 2 to 3 minutes and lower your head. Place a finger on the tear duct and apply slight pressure. Wipe off excess fluid from your face with a tissue. Wait at least 5 minutes before putting in the next drops, if necessary. Screw the cap on the dropper bottle and tighten it. Do not wash or wipe the dropper tip. Wash your hands to remove the medicine on your hands.